morning, everyone. This is Bill Miles with the Hilton Head Island Bluffton Chamber of Commerce, and thank you so much for joining in with us again today. We just had some breaking news, and I'm pleased to report that we just found out earlier this morning that Hilton Head Island has been recognized in TripAdvisor's Traveler's Choice Best of the Best Awards. So another great shout out for the destination, and I can assure you that we'll be seeing more of that, as it was syndicated 100+ times, and it recommends the destination for sports enthusiasts, nature lovers, golfers, and so much more. And we know that TripAdvisor is a trusted source, and it comes to us in a combination of both positive ratings and reviews over the last year. And so what does that mean? It means that our partners are doing a great job in providing fabulous experiences and great customer service for not only our visitors, but our residents as well. Also want to give a shout out this morning to Second Helpings, and the Chamber was honored to be presented with the Founders Award from Second Helpings, and certainly a thank you to them and the important work that they do by certainly providing food and trying to rescue food and then provide the food to those in need. So it's a great organization, about 341 volunteers, and they serve over 55 pantries. And if you haven't checked out the work they do, I'd encourage you to do so. And also in on that partnership and making that happen was the Sonesta Resort, who provided cooler bags for Second Helpings to use, as well as Kroger. And Kroger has been a substantial partner of Second Helpings as well, and so many, many more. Also, while I'm giving shout outs, can't let the moment pass without giving a shout out to Kayla Boyder on our team. And today's Kayla's 14th wedding anniversary. And she's married to Benji, who works at Sea Pines, and just wanted to say happy anniversary to Kayla and 14 wonderful years. I see that the questions are already starting to come in, so thank you for that. Continue submitting those. And I just want to remind you that, we all read different pieces in the media, see different pieces, different things on social channels. But the real purpose of the Power Hour every other week is so we can continue to provide the unfiltered and real-time information directly from our speakers. It's hard to believe that this is the 41st in the series that we've been doing. So our 41st Power Hour is coming at you today. I also want to mention that in addition to those who are dialing in directly, we also have listeners on the Chamber's Facebook page, as well as the town of Hilton Head Island and Bluffton social channels. And then lastly, as far as that goes, I want to give a shout out to Scott Grooms, and Scott heads up the Beaufort County channel, where another 800 to 1,000 listeners are turning in each week to hear the latest news and information. We've got a great call scheduled today with another terrific lineup of speakers, and we want to jump right into that. And to kick things off is certainly not a stranger on our calls. It's Dr. Jane Kelly with DHEC, and Dr. Kelly is back with us to provide additional information. And you might have seen Dr. Kelly as she was appearing virtually at the Hilton Head Island Town Council meeting, I believe it was last week, providing valuable information to our council leadership. Dr. Kelly, welcome, and thanks for joining us.
Thank you so much for inviting me. I'm going to pull up my screen as usual. I've got a few slides I'd like to share with you. There it goes. Okay, hopefully everybody can see that. I want to start with the statistics in the beginning, and this map reflects the average number of daily cases per 100,000 people over the last 7 days. And as you can see, South Carolina is in that highest category of 69 to 95 new cases per 100,000, but it's even higher than it appears. For the past 2 weeks, the rate of new cases in every county in South Carolina was more than 200 per 100,000. So sorry to be the bearer of bad news. Fortunately, it looks like that's beginning to plateau. So I, cautiously hopeful that people understand what needs to be done. We've done it before in South Carolina. In July, We had a surge of cases and it came down. We're having another surge. We all anticipated this, what with the holidays and being indoors. Hopefully, though, people can batten down the hatches and flatten this curve. Here are the numbers for cases and deaths over the last 2 weeks. In the United States overall, we've had an increase in 2.4 million cases and an increase of 40,000 deaths. So our total deaths are over 400,000. It is anticipated in the United States that we will unfortunately hit a landmark of over 500,000 deaths before this is over. In South Carolina, we've had 22,000 plus new cases, 84 new deaths. And in Beaufort, over 1,000 new cases in the past 2 weeks, an additional 14 deaths. I want to talk about a couple of issues that have arisen with vaccine administration. Severe allergic reactions, also known as anaphylaxis, have occurred with both the Pfizer and the Moderna vaccine. For the Moderna vaccine, nationally, there have been 10 cases of allergic reaction, and that works out to be about 2.5 per million doses. This is not unexpected to have an severe allergic reaction after a vaccine. I mean, to put this in perspective, about 1 out of every million doses of influenza vaccine causes anaphylaxis. So yes, this is higher, but it's not unexpected. What we recommend is that if one has a history of allergy, to forewarn the pharmacist, the nurse, whoever is giving you the vaccine, so that they are on extra alert. And that what we have found with anaphylaxis across the nation is that the onset is usually within 15 minutes. There have been no anaphylaxis related deaths. There have been a few people hospitalized to stabilize them overnight. For the Pfizer dose, there have been an increased number of anaphylaxis cases, about 11 per million doses, but I would warn you that doesn't mean that Moderna is better than Pfizer. I mean, these are still small numbers. Sometimes there's reporting bias, meaning that somebody might have had an anaphylactic reaction, but it didn't get reported to the CDC. But just wanted to put it out there that it's not a surprise that there are some severe allergic reactions, and it is in the same ballpark as allergic reactions we might get with other vaccines. You may have heard about the new variants. This is the map of the British variant. It's also known as B117. This is the map where it currently has been found. You can see South Carolina. It has not been found in South Carolina, but we're surrounded. It's almost certain that this variant is here in South Carolina. We just haven't detected it yet. I think last week I mentioned this variant and said that the good news was that it looked like there was no increased severity associated with this. There have been 2 studies recently published that suggest that it may be, in fact, associated with an increased risk of death, that there may be increased case fatality with this variant. We know that it spreads more quickly. It is likely in South Carolina. There is some concern that there's an increased risk of death. There are some other variants. There's a Brazil variant that has been found in Minnesota. There's a South African variant that hasn't been found anywhere in the United States. But this is not unexpected. Viruses mutate. We're going to start seeing some variants as they spread. So what does that mean? Well, there are some things we don't know, and I think I've mentioned this before also. We don't know how these new variants might respond, for example, to medication or to monoclonal antibodies. There is a possibility that if you previously had COVID-19, it might not protect you completely against a new variant. You might get a reinfection. There's also some worrisome signs that the rapid tests might not detect the new variants. So if you have symptoms, if you've been exposed, if you're concerned that you have you may have COVID-19, don't rely on a rapid test. A rapid test is helpful. It'll give you an answer right away. And if it's positive, you can trust it. But if it's negative, there's a certain number of false negatives, and it might be worse with these new variants. So the gold standard is that swab test, either nasal swab, oral swab, saliva test. It's the PCR test, because even if it's a mutant virus, even if it has one of these variants, that mutation will just impact one of the targets for the PCR test. And the PCR tests look at lots of different things in to pick up the virus. What about vaccines? Well, we know that the Pfizer and Moderna companies have come out with a statement that their vaccines do work against the British variant. How can they say that? They've done some sophisticated lab tests with looking at antibodies, whether those antibodies will work against these new virus strains. So they've done that in test tubes, not in humans, but they have some pretty good data. What about the South African variant? It has more mutations, and that is a more worrisome thing. So I want to go back to the basics. I think you guys have seen this slide before. The whole idea of our two vaccines that we have in this country right now, they have the piece of genetic code, just the gene for one protein, that spike protein, which is the one that the virus uses to attach to the cell. You inject that in the muscle, the vaccine triggers production of spike protein, antibodies, revs up, your immune system to respond to it. The reason I keep harping on the biology is because I think it is helpful in understanding what do we do next. The advantage of these messenger RNA vaccines, these genetic code vaccines, is you can tweak it. It's a lot easier than, for example, the influenza vaccine. You know how flu is different every year? You need to get a new flu shot every year, but it seems to take months before they can produce it. That's because they're growing it in cell cultures. This is going straight to the chemistry lab of, you've got this nucleotide sequence, you've got the genetic code, and you can change it out. You can change out the couple of nucleotides, the ones that mutated in the new variants, and put in theirs instead. So in some of the preprint reports, that's the bioarchive reports, there's really early information that the vaccines work against the British variant, may not work against the South African variant as well. But what the companies are doing is they're working on a booster to kind of change out those nucleotides. So the vaccine, we know we still have limited vaccine. If it turns out these variants start to become prominent in the United States, the vaccines can be changed to accommodate that as well. What about the doses that have been received in South Carolina? So far, this is new this week, we have over 600,000 doses of both Moderna and Pfizer, about split evenly between those two vaccines, have been delivered to South Carolina. Almost 300,000 doses have been given. This changes on a weekly basis. So for example, we just get 60,000 doses. Of course, it's going to take a little time to get it into arms. So of the Pfizer vaccine, 65% of it has been utilized. The Moderna vaccine, utilization's a little bit lower. Part of that is because it goes not only to workers in healthcare settings and others, it also goes to long-term care programs. So that's through CVS and Walgreens pharmacies that go to nursing homes. Good news is that for those nursing home and assisted living settings, the residents and staff who wanted to receive vaccine, who agreed to have vaccine, they have gotten their first dose. Even this slide is a little bit out of date. The numbers are higher. Even this morning, it's more like 30,000 have gotten their first dose of vaccine. But not everybody is accepting vaccine. Some people are declining vaccine. They may change their minds. They can get it later if they change their minds. This is the map that DHEC is currently using if you go online to try and sign up for COVID-19 vaccination. You look at this map, the green sites are sites that have been activated for giving vaccine. That means that their systems have been turned on, they have been sent vaccine. That doesn't mean that they have appointments open right now. The red squares are sites that have been enrolled in our vaccination program, but of course we don't have enough vaccine to spread it to everyone. So the red sites are the sites where vaccine will become available, but aren't available yet. I'm going to make two comments about this map. Number one, it is annoyingly difficult for people to use. This is not user-friendly. People click on a green spot thinking they're going to be able to make an appointment, and then they find out appointments are all full. So they click on another one and another one and another one. I know people are very frustrated with this system. DHEC is working on a different system that would be similar to what's used, for example, in Mississippi, in Virginia, and some of the other states where it's centralized. You don't have to click on each individual site. You enter your information, you enter your zip code. It will give you a choice, a selection of a number of different sites that are available. You can indicate whether you want that within 25, 50, 100 miles, and they'll tell you how many doses of vaccine are available in different places. Click on that. It will then give you options for a day, a time for making an appointment. We pilot tested that at DHEC last week, and I was one of the participants. So I can report that it was user-friendly. We have some concerns about, we were pilot testing it with hundreds of people. What's going to happen when tens of thousands of people try to use it? So they're working on that. The IT team is working on that right now. The other thing I wanted to point out about this map is you can see there are clusters, right? There are clusters where we have population clusters in cities. What about those more rural areas? We are going to have mobile vans that will be going to some of those more rural areas. I know some folks have asked me, for example, in the Beaufort area, when they try to make an appointment at, for example, Hilton Head Hospital, that there are no appointments available. Remember, everybody gets shipments of vaccine on a weekly basis. So it may be frustrating right now. You can't get something locally, but you can in Charleston. It has to do with the initial allocations. It's true that Charleston, a higher population area, has received a greater amount of vaccine. Vaccine is being allocated on a county by county basis based on population. But we're working to improve this system as more vaccine becomes available. This system will change. People will find it easier to make appointments. We're also partnering with AARP because some people have older adults who may not be as tech savvy or even not have an email address, that they have been frustrated feeling left out of this appointment system. We're working with AARP to have a 1-800 number, both at DHEC to help people with enrolling for vaccine and through AARP. That's all I brought. I'm happy to take questions. And I see there's one question. I see already there's a question. And sorry.
Yes, I'm sorry. Yeah, thank you. And great information. Very, very good information. Our first question that we want to ask this morning is coming from Jennifer. And Jennifer's asking, how do you feel about the efficacy of at-home COVID testing products versus those from medical providers?
So the key thing about both medical providers and the at-home testing products is that you get an adequate sample. Those testing products can be just as good. They're PCR, they run them in that machine that looks for the genes. They can be just as good, but you need to be not squeamish. If it's a saliva sample and they say you need this much, you need to make sure you produce that much saliva. I mean, and that can be a challenge for people. It takes a while. If it's a nasal swab test, you need to not be squeamish about getting an adequate sample. So the efficacy of the at-home products is high. It depends upon user technique, making sure you have an adequate sample that you're sending in. Otherwise, they should be just as good as the ones that you might get done by a healthcare professional.
Thank you for that. Next question, Dr. Kelly, is from Tom. And Tom is asking, is the single dose going through approvals now more effective or about the same as Pfizer and Moderna?
So there are two other vaccines that I think are going to come up for approval in February and probably will be approved. That's the AstraZeneca and the Johnson & Johnson, sometimes also called the Janssen vaccine, named for the companies that are producing it. The Johnson & Johnson vaccine looks like it will be single dose. AstraZeneca may be single dose or 2 doses. It depends upon their sub analysis, because they also want to look at by age group. Sometimes people who are older adults need a booster shot, whereas younger adults don't. It's looking like their efficacy for Johnson & Johnson may be as high as 90%, but they haven't released all of that phase 3 data. I'm basing that statement on a much smaller group of people that they've tested in their phase 2 studies. So it looks hopeful that it'll be 90%, but we need to wait until they get all their data on the table.
All right, thank you. Next question is from Emily, and Emily is asking, why does the vaccine cause a reaction in some people?
And probably what's causing the reaction is not the RNA part itself, but rather the oil coating. So RNA gets digested by enzymes in your muscles very quickly. So you can't just inject the RNA. You have to put a lipid coat, a nanoparticle coat, it's called, on its surface. And that includes something called polyethylene glycol, which is actually a common ingredient in over-the-counter laxatives, and in bowel preparation for colonoscopy, but it is probably that polyethylene glycol that is giving people allergic reactions.
Next question is coming from Eric, and Eric is asking, are you concerned that variants will impact the efficacy of the vaccine?
Well, we have good data that it doesn't impact that the vaccine still works for the British variant. And that makes sense to me. The British variant there are changes in 20 nucleotides. That's like the letters in the genetic code. Well, the spike protein's 3,000 letters long. So, okay, it affects a part of it, but the vaccine will work for other parts of that spike protein. So I'm not worried about the British variant. The South African variant has more mutations. There is a reason to be concerned. They're looking at that right now, trying to test it. We don't think we have the South African variant here yet. But I think that may be a matter of time, even if we are blocking flights from South Africa to the United States. Viruses mutate all the time, so it could spontaneously mutate into something similar to the South African variant. So in answer to your question, for the British one that we know is pretty widespread already, vaccines work. For some of the other mutants that may come down the pike, the vaccine might not work as well. One last thing to remember, though, the vaccines we have right now are 95% effective. That's about as good as it gets. So if it drops down and maybe they're 80% effective, that's still not bad. That's way better than many other vaccines that are in common use today.
Thank you for that answer. Next question is coming from Rob, and Rob is asking, have all nursing home residents been vaccinated?
No, because of course, people have the right to refuse. So there are some nursing home residents and some nursing home staff who have declined receiving vaccine at this time. In some cases, it may be older adults who are not able to make decisions for themselves, but they have a medical proxy, a family member who has made that decision to not receive vaccine at this time. They have the right to change their minds, though. I can understand some people are vaccine hesitant because they just feel like this is too new. I don't want to go first. And right now we have about 20 million people in the United States who have received either the Pfizer or Moderna vaccine. And you've heard we've not had any serious side effects. We've had some allergic reactions. It may be that people in nursing homes or their family members may change their minds. Currently, everyone who has agreed in South Carolina who wanted a first dose of vaccine have received a first dose of vaccine.
Okay, thank you. And Karen is asking, why is the age to get a vaccine 70 in South Carolina?
It has to do with the severe shortage of vaccine. I'm aware that there are surrounding states, many other states, and in fact, HHS's recommendation was 65 and older. South Carolina has stuck with 70 and older, not because we don't want people between 65 and 70 to get vaccinated. Of course we do, but we're really worried about we've only getting 60,000 doses of vaccine a year. There are over 700,000 people age 70 and above in South Carolina. We want to make sure we get vaccine into the arms of the 80-year-olds, the 85, 90-year-olds, because they are at much higher risk than the 65-year-olds. And that's why we have stood strong about saying 70 and older. I mean, I'm in that 65 plus age group too, but I want to see vaccine going to the most vulnerable, and that's the people who are 70 and older, especially the 80s and 90-year-olds in our communities.
All right, thank you. A couple of more questions for you. Dr. Cox is asking, how will sites registered as third party interact with central system?
I'm not sure I completely understand that question. Can you clarify that?
I can't clarify that. We might get a little clarification on the next email coming in. Another question for you is coming from Thad, and Thad is asking, you have to live in the county you get your vaccination. Would a Bluffton resident be turned away if they try to get a vaccine in Charleston?
No, you can get your vaccine anywhere statewide.
Okay, and then Kim is asking, when do you think the new appointment system will be available?
Hopefully this week. That was the plan. It was pilot tested on Friday last week. Then they worked on tweaking it over the weekend, and then they re-pilot tested it on Monday. The big concern is that when thousands of, we tested it among hundreds of people. When tens of thousands of people use it, will it have that capacity? We don't want it to crash. So the goal is to have it available by the end of this week.
Great. Thank you so much. And again, this week, just as in each week, there's many thank yous that are coming in saying thank Dr. Kelly for her time for being with us each week. So again, thank you. Terrific information. Thank you for what you do. And we'll be in touch with you on our next call. Okay,
great. Thank you so much.
All right. That was Dr. Kelly with DHEC, speaking all things vaccines. Next, I'm proud and pleased really to relay that our next guest oversees the medical facilities that are currently ranked number 2 and number 3 in statewide effectiveness, and for how quickly that they're distributing the vaccines to Low Country residents. So what does that mean? It means that when Hilton Head Hospital and Coastal Carolina Hospital are getting the vaccines, they are getting it into people's arms quickly, and they're second and third in the state. So to hear more about that and other things, we have with us Jeremy Clark. Jeremy?
Good morning, Bill. Thanks for having me this morning. How you doing?
Doing great, thanks. Good to see you.
Great. It's good to be back here, and it's always great to follow Dr. Kelly, who always does an awesome job on this call, and I appreciate the kind words on the introduction. Happy to give everyone an update with what we're seeing here locally. To start off this morning at Hilton Head Hospital and Coastal Carolina Hospital, we have a total of 17 COVID positive patients in our hospitals, with one of those in the ICU. So 17 is a lower number than I reported on this call a couple of weeks ago. It's still high. It's lower than it was a couple of weeks ago. It's lower than it was back in our summer peaks, and hopefully optimistic after Dr. Kelly's report that she believes that the number of new cases may be plateauing, which is a really good sign. So we're managing that. We're also taking care of many more patients who do not have COVID. And so it's just a busy time for all of us. But I want to give everyone an update this morning on vaccines and vaccine distribution and what we're seeing. So, as I reported before, for as challenging as the COVID-19 situation has been over the last 10 months or so, the promise of the vaccines is very exciting. And we started vaccinating our frontline employees and medical staff on December 16th. Every single member of our medical staff and every single colleague who wanted a vaccine was able to get one. After that, we expanded to local EMS partners, volunteers in medicine, and phase 1A healthcare workers. Starting on January 13th, we started vaccinating the over 70 crowd, and to date, we've given over 4,000 first dose vaccines. So we're moving forward in this process. Bill, as you referenced, just last week, we were honored to receive a visit from Governor Henry McMaster, who came here. It was great to hear him recognize the good work that Hilton Head Hospital and Coastal Carolina Hospital have been doing when it comes to utilizing the vaccine that we're giving. As you referenced, we're two of the top in the entire state for vaccine utilization. And what that means is that when DHEC gives us vaccine, we are able to get it in the arms, we're doing a better job of getting it in the arms of people who need it than almost every other hospital in the state. So that's quite an honor, and that's something that we take very seriously. We're going to keep that up. Very simply, the number one challenge right now is just the supply of the vaccine. And you heard a little bit about that from Dr. Kelly. There's just not enough vaccine right now available to meet the demand. And that's nationally, it's statewide, and it's locally. I think DHEC is doing a great job of getting that vaccine out to hospitals and other pharmacies and other providers. There has been some confusion over the last few weeks as to the amount of vaccine that hospitals will receive, and that has led to some cancellation of appointments. But that's not unique to South Carolina. That's really happening all over the country right now. What I would tell you is if your appointment is canceled, please work with the provider that you had to get the appointment rescheduled. I will tell you that we're working very hard to, whenever we have to cancel someone, to get them rescheduled for the following week. Another big frustration has been the technology used to access the vaccine. It's great to hear the update from Dr. Kelly on the improvements that DHEC is making and piloting. I think that's only going to help as more vaccine comes online, so that's great to hear. Today, the best way to make an appointment is to start at our website at hiltonheadregional.com. Click on the vaccine information link, and there's a form there where you'll put in your name, your email address, a couple other data points, and you'll submit that. I have to note that it must be a unique email address, so it cannot be shared with someone else, and it cannot be an email address that is already in the CDC VAM system. But that starts the process. Within 24 to 48 hours, should receive an email from the CDC with a link to begin that process. We have set up a call center. We set it up a couple weeks ago. It is open 7 days a week from 6 a.m. to 6 p.m. The number, I'll give the number for everyone. It's 843-689-7282. That number can give you some hints on getting registered, and you will be able to talk to a live agent on that call who can help you as well. You know, other ways to get appointments, I would just ask everyone to be aware of new providers coming online. More and more pharmacies are coming online as well. I know David Burke's on the call. I know they're participating in this. I know that representatives from Kroger are on the call as well, so I'm excited to hear from them. So these individuals, these organizations may be opening up appointments, and you may be able to get one more sooner than you would be waiting at your hospital appointment. We know that many of the hospitals we have appointments booked out, into March, into April. So hopefully there will be more appointments coming online and becoming available, and some of those folks who have appointments far out can move into those new spots. We would also love to host some mass vaccination events, as other communities have done. We know that we have the local community support to do this. We know that we have the National Guard support to do it. So the manpower is not necessarily an issue. The facilities are not an issue. But again, the problem is the commitment to being able to have vaccine available for such an event. So, all in all, right now, I just echo the governor's request for patience. We do believe that South Carolina is getting its fair share of vaccine from the federal government. We believe that DHEC is doing a great job of getting this vaccine out to hospitals and other providers. And we know the hospitals and other providers are getting it in the arms of the people that need it. We are all continually refining our processes to become more efficient. And as we do that, that may involve changing of hours of operations or changing locations of the clinics. But these processes are new to the CDC, they're new to DHEC, and they're new to us as well. So just asking everyone to be understanding, and we're all going to continue to get better. It's just right now there is very limited vaccine available, but we know that this will change in the coming months. So Bill, to wrap up, I just want you and everyone on the call to know that our hospitals remain ready. We've created a safe environment that we are caring for COVID patients, but we're also caring for many more patients that do not have COVID. We appreciate the leadership and the partnership that we have with our state and local officials. Always appreciate everyone's support for our caregivers who are working very hard right now. And just want to remind everyone to continue to wear a mask, wash your hands, and keep your distance. And Bill, I'll turn it back over to you for any questions.
All right, Jeremy, a couple of questions here. One is from Robert, and Robert is asking, are you having to hold back vaccines to be used for second doses?
It's a great question. We are not holding back vaccines for second doses. Every week we receive our shipment from DHEC on Tuesday morning, and by Friday afternoon we have used it all and are waiting for our next shipment. So we're not holding back anything. That said, we have been assured by DHEC and are seeing from DHEC a commitment to getting the second doses to people when they are scheduled. So everyone that gets a first dose in our organization will leave with an appointment card for a second dose. And we have full faith that DHEC will be able to provide those second doses when those times come.
All right, thank you. Next question is coming from Julie, and Julie's asking, when you have enough vaccine, do you plan to expand the hours of distribution?
Yeah, it's a great question. I think when we have enough vaccine, there will be different ways of doing this, whether it's new locations, new hours of vaccine clinics, and just new ways of doing it that I think will be more efficient. Right now, we feel like we're working the most efficiently as we can, but as more vaccine comes online, we'll evolve our processes to match that.
Jeremy, the last one is a statement, not a question, but it's coming in. It says, "Thank Jeremy and his HHI hospital staff for treating me for COVID. They truly saved me, and I am on the way to recovery." So I wanted to share that with you.
Great to hear. Thank you so much for your kind words, and thanks for support for our caregivers.
All right, thank you. That was Jeremy Clark talking things about vaccines locally. And again, congratulations, Jeremy, for being number 2 and number 3 in the entire state on vaccine utilization.
Great. Thanks a lot, Bill. Thanks for having me this morning.
Thank you. We'll transition now to Dr. Panu, and we know that in higher education, both students and staff are having to be nimble as the pandemic continues. And here to talk about the pandemic impact on campus is Dr. Al Panu, the Chancellor of USCB. Dr. Panu, welcome.
Thank you so much, Bill, and thank you so much for the opportunity to update our entire community on some of the work that's been taking place at USCB. Throughout the planning and response to COVID, starting from late spring, we've been really guided by the priorities of ensuring health and safety for the entire university community, mitigating the spread of the virus, of course, and maintaining academic excellence and long-term stability of the university. And this spring semester, we really leveraged from some key lessons learned from the fall, and including the value and the critical importance of protecting the most vulnerable, whether they are in a category of age or pre-existing conditions or having to take care of some family members. We have made the proper provision to ensure that level of protection is granted. We've also learned and continue to apply the lessons from having a structured environment where protocols are reinforced being a really risk mitigating strategy. And we've learned, for instance, throughout last semester that because of the structured environment where the protocols are in place, we had fewer instances of COVID for resident students, for instance, than for community in general. And the importance of mitigating the virus through the protocols that are in place, and really associating strong incentive and possible just ensuring that the students are really in compliance with that. And that's been really, really critical. And I want to give kudos to our students. They have been champions and student leaders in really helping a peer-to-peer approach to promoting just compliance to mitigation. We took measures to reduce capacity in classroom. Most classrooms are at 1/3 of their capacity, just in terms of how many we can have there. Not to mention the fact that we have multiple modality for delivery of instruction, ranging from traditional face-to-face all the way to pure online instruction. And last semester, we observed no cases of classroom transmission that we know of at all, no hospitalization. We have very rigorous contact tracing of our own, in addition to DHEC, obviously. And we have set up a dashboard for reporting on a weekly basis the cases of new cases, as well as the number of tests and so on, to just really give a sense of what's going on campus. We instituted mandatory testing for all resident students last semesters, and we've done it again this first week of return in January. And we strongly encouraging our non-resident students as well to participate. And new to this semester, we've also instituted weekly random testing of 100 selected individuals, randomly selected individuals to be tested. And we really think that that's also going to help us better understand what's going on in the entire populations. Our quarantine and isolation spaces right now are still highly available. We probably only have a 10% occupancy or less, actually. And with regard to instruction modality, we've been guided by surveys that minister to students. As we know, most people learn uniquely and differently, and we want to make sure that we are very accommodating about the different ways in which students prefer in their learning and instructional delivery. One of the things that we did last fall in anticipation of the spring semester was to do away with our traditional spring break and replace it with well-being days that are distributed throughout the semester. And because, of course, lessons learned about what happened post-holidays. And so we thought it was the prudent thing to do, and we'll see how it works out. We're looking forward to that as well. On a vaccine front, we are excited to have partnership with Jeremy and with BMH and engaging our students, especially nursing and public health students who are considered frontline workers and faculty in those disciplines in all the efforts for administering the vaccine. And so we're really excited about that, and it's working out well in terms of that partnership. We're also hoping to continue the efforts to prepare for possibility of serving as a site for a mass vaccination event, as Jeremy alluded to in the presentation he just made, that if that should become a possibility, we certainly are on a table to be able to serve in that capacity. We have served as sites for testing as well, and we'll continue to do that as we move forward. And we just really continuing to make those efforts. We know that this is a fast changing situation, and we are staying very alert to that, so that if it becomes necessary for us to make some additional changes to the plans that we have, that we would be able to do that. We really appreciate the community support, and we are delighted to be able to continue to work with all of our partners to ensure the safety for the entire community. Thank you, Bill.
Dr. Panu, thank you so much for being with us. Just a couple of questions for you. I know that you have another meeting that you need to john off to. The first one is, what does USCB have in place to deal with some of the mental health issues faced by students during the pandemic? And that's coming from Jennifer.
Yeah, that's a great question, and it's something that we've observed throughout the entire. So we do have enhanced access for mental health. We have obviously counselors in place, but we are aware of that, and we're making a lot of effort to provide greater access to not only our advisors, but if necessary, to reach out to other institutions for that additional support.
All right, thank you. And the last question is, Dr. Panu, are students currently sharing dorm rooms?
Yes, we do have really good housing options, and yes, they are those that obviously when we're looking at isolation quarantine, that there's no sharing of space there, but we've traditionally had the units that gives you a lot of independence and over the shared bathroom and kitchen. So yes.
Dr. Panu, thank you. We'll let you run. Certainly appreciate you being with us again today.
Thank you so much, Bill.
Yes, sir. Okay, we'll transition now. And we heard that Jeremy and Dr. Kelly talking a little bit about how the widening availability for vaccine distribution is coming about. And Jeremy had mentioned David Burke and Burke's Main Street Pharmacy on the call. And today also on the call that we have with us back. And we've had fortunate to have Felix Turner. Felix Turner is with Kroger, and he's the corporate affairs manager. And we also are glad to have the pharmacy manager and health team member, Manish Sandhu, with us. So Felix, welcome back to the call. Looking forward for an update on the distribution from Kroger, and we appreciate your support today.
David, excuse me, Bill, thank you for inviting us again, and we're excited to be on the call. Again, we at Kroger, we see that this vaccine distribution is a critical mission, and again, we're pleased to be a part of the team that's ensuring that the most vulnerable residents of South Carolina are getting access to the vaccine. We're definitely strongly encouraging all of our customers and associates to receive the vaccine as soon as possible. And again, we're going to do everything that we can to ensure that that they have access to it more widely. So I'm really excited to have on the call today Manish, which is part of our health team. And she'll be able to share a lot of information, or some of the information, some of the questions that you sent before. So at this point, I'm going to turn it over to Manish.
Good morning. Thank you, Felix. Thank you, Bill. Thank you, everybody. Just wanted to say we're very happy at Kroger Health, Kroger, to be part of the solution. It's been very uplifting in our pharmacies, and our pharmacy staff they've been sharing how it is just so uplifting to hear the stories and see the tears on people's faces when we're administering these vaccines. So we are really happy and proud to be part of the solution. A lot of great things happening at Kroger. We did open up appointments last week. We received our first allocation, and within 24 hours, even in South Carolina, we had full availability, and it was taken up within the first 24 hours. So it just goes to show you that the demand is there, and hopefully, as everybody, as Mr. Clark and Dr. Kelly has already mentioned, that really it's the supply that's an issue. We are ready, willing, capable. We've got our ducks in a row. We know what we're doing. We just have to get a hold of, hopefully some supplies. We're working very close with DHEC, and even in Georgia, we're working close with the Department of Health, just so that we can get, an idea of what's coming into our pharmacies and how we can allocate them. That first allocation was already put out. We administered first doses. We're finishing up what we have right currently. We have a scheduling tool, so patients can actually go online, and it's Kroger. It's Kroger.com/COVID info. And it gives you, again, you would put in your zip code. It'll help you get to a pharmacy. Right now, we are fully booked for appointments, but that is the resource that we have. It's a scheduling tool, so patients can easily make the appointments. Unfortunately, we cannot accommodate them right now in the pharmacy to make appointments, but we are directing them to the online service. It's been a little bit difficult as far as getting information to the public, but I'm really happy, and it's encouraging to hear the updates that are happening on the site. So the new system should help as well, especially for patients, just to see where they can make appointments. And so we'll be part of that as well. And we're just, as a company, as providers, as healthcare providers, our vision is to help people live healthier lives. And this is really impactful. So we're excited. We're confident we're going to get supplies. Hopefully the communication about the supplies will come to us, and we can trickle that to our patients. But we're excited to be part of the solution, and I'm happy to answer any questions or give any more updates.
Thank you so much. A question is coming to us from John, and John is asking about the plan to vaccinate Kroger employees.
Great question. So we did start off with the phase where healthcare providers, so our teams did get vaccinated, and yes, our grocery store, they're very important to us as well. And so they will be part of the next phase, and we are happy. We cannot wait to vaccinate everybody in the stores because they've really been on the front lines. as soon as we can do that, as soon as that phase, we're communicating directly. So starting to get the supplies, moving into the phases, that'll help us to vaccinate all our frontline store employees as well.
Okay, thank you. Lily is asking how frequently should people check back for open spots?
I think it's really good that we're getting that new system for DHEC, especially in South Carolina. It will start showing, I think, as things progress, as weeks go on and we get more of a supply and better communication from state departments and from the federal department, I think it'll be a really seamless. I think we've got growing pains right now for the communication, but you can definitely, as soon as you start seeing in the DHEC or state allocations, we're going to jump on it. And Kroger, we've got our availability. We know how to plug into our scheduling tool. So it would be within hours that we'll start uploading appointments. So if you're starting to see it on the site, we're not going to delay. We're anxious to get these into arms. And so as soon as we can, we'll open up appointments and you can just check back. If you start hearing, that supplies are coming in statewide, chances are we're opening them momentarily right after that. We're ready and willing.
Okay, Manish, thank you. And Felix, thank you for joining us today. We appreciate the work that Kroger is doing and also the support of our community here. Thank you very much.
Thank you.
Thank you.
All right. And as we transition now to our next caller, before I move there, I want to also, we had a message from Berks Main Street Pharmacy saying that they do have vaccines and they're taking appointments. And we'll also, as we posted the one for Kroger, we'll also post where you can sign up for Berks. And again, this certainly isn't a competition. This is great community players trying to get the vaccine in the arms of those who need it as quickly as possible. And so we thank you to Kroger and thank you to Berks and all the others and the hospitals that are helping to get those vaccines out. Our final speaker this morning is a gentleman that in July will celebrate his 8th anniversary at Volunteers in Medicine. And as a community, we're certainly better off for his leadership at VIM and all the great things that he and his board and volunteers have been able to accomplish. And I'm pleased and proud to introduce to you today Dr. Raymond Cox. And we know that the pandemic impacts us all differently, and he's going to talk a little bit about how Volunteers in Medicine is addressing that. Dr. Cox, welcome. Did we just go?
Can you hear me now, Bill?
There we go. Yes, sir. Yes, Dr. Cox, welcome.
Yeah, look, thank you for that very gracious introduction. I really appreciate that. But I want to start off by apologizing to Dr. Kelly for asking her a question that she may not have become familiar with yet. There's some of it, when we get to the point where we're getting vaccine out to the community providers, particularly those who are taking care of underserved populations, we are going to selectively try to care for those populations first. So I do have some concerns if we go to a unified system about being put in a position where we're caring for people other than those underserved patients who we want to selectively make sure are getting vaccinated. So I just wanted to make that point first. Volunteers, and we're going to talk a little bit about Volunteers in Medicine, assuming that most of you on the call have some knowledge about Volunteers in Medicine. Then we're going to talk about how COVID's impacted us, and then talk about a program that we're pretty excited about, but that we need your help for. Volunteers in Medicine, as we are now celebrating our 28th year in this community, and is the brainchild of Dr. Jack McConnell, who started Volunteers in Medicine in 1993. Our mission is to understand and serve the health and wellness needs of the medically underserved and their households who live or work in Hilton Head and the Flusky Island. I'm gonna try to see if I can share my screen here with you all. Get what? Sure. Oh, sure. For those of us who are technically challenged. Okay, very good. Can you see that now?
Yes, sir. Well done.
Right. So yeah, it took a minute there. I'm getting some coaching from my staff here. So as I said, we're How do I advance this? There we go. Mission is to understand and serve the health and wellness needs of the medically underserved in their households who live or work on Hilton Head and the Efficacy Island. That first year that we were open, we served about 1,000 patients. Over the past 5 years, we've averaged about 27,000 visits a year. We are the largest free and charitable clinic in the state of South Carolina, one of the largest in the country. And we now serve as a model for 92 other clinics who are around the country who were built on this model. So we're located at 15 Northridge Drive. We serve people who are uninsured or underinsured and at 200% of the poverty level or below. We have new patient registration on Monday and Wednesday afternoons specifically, but we also screen people as they come in when necessary. We do not accept government funding. We live totally off of the generosity of the community through the donations and through grants. We have over 650 volunteers. 100 of them are physicians. We have 22 dentists now who serve 23 medical specialties. So we really are a very comprehensive service for the community and provide over 50,000 volunteer hours annually. This helps us provide significant value to the community, and we save Hilton Head community approximately $12 million a year by providing these volunteer services. We also have a significant impact, of course, on the hospital in reducing the number of uncompensated care visits they get to the emergency room. A few years ago, we did a study to look at where our patients came from, and we did this in cooperation with the University of South Carolina Institute of Families and Society. And what we found is that these areas that you see here in red and in orange, where most of our patients come from, these are people who have very high incidence of adult and childhood disease, as well as uninsurance, high incidence of uninsurance and poverty levels. We are located in this red area here, so you can see that we're ideally located. For those of you who may not be familiar with the island, this is actually the Baycall Old Mitchellville area here, which is in red. Over here is the Squire Pope area. This is the Spanish Wells area. This is the Cordillo Parkway area. This is Chimney Cove. And this is the Marshland area. The people here who live in this red area have a life expectancy. If we look at other communities around the country where they have enough people to do these kinds of studies, we find that the life expectancy in these communities that have this high incidence of poverty and uninsurance is 10 years less than people who live in this case, the gated communities who live on the island. Clearly, that's not a situation that we're very proud of. But what we think, looking at our preliminary data, is that we've been able to mitigate that by improving health outcomes to the patients that we serve. So this is a slide just to show you that this is not the first pandemic that we've had to, well, not we specifically, but that the world has had to deal with. The worst, of course, was the Black Death, the bubonic plague back in 1347, which wiped out half the population of Europe. And as you can imagine, that had a significant impact on the history of mankind going forward. We're not in that desperate a shape yet, but we have had to make significant changes related to COVID in terms of protecting not only our patient population, but also our volunteer population, 95% of whom are over the age of 65. One of the things that we've done recently is to get a grant from Community Foundation through the HUD grant that allows us to put together a program called Project Isolate Safe. What this program does is to provide free housing, isolation supplies for patients who test COVID positive and who either live in congregate households or multi-generational households and can't isolate safely at home. So we have found some apartments that will allow us to offer these apartments for free to patients who may need them, COVID positive folks who may need them. But just as importantly, we put together COVID boxes that contain PPE, personal protective equipment, thermometers, pulse oximeter, and a lot of educational materials so that if they have to isolate at home, they can do it more safely. We have a good partner in Deepwell who also provides food boxes for these patients and for these folks. And that's working out very well. So far, we have 5 patients in this program. I need your help in identifying people and getting the word out, that this program exists. But also we believe that there are a lot of people, frontline workers in particular, who might benefit from needing isolation housing. These types of programs have been done in other communities around the country, such as Tampa, New York, and Toronto in Canada. So we know that these programs can be helpful in mitigating the spread of COVID, but we want to make sure that we have that opportunity here on Hilton Head as well. These are the phone numbers that you can register clients for in English and in Spanish. And we have Ms. Kathy Brookshire, who is our program coordinator, as well as Cecilia Myers, who is our Spanish interpreter for this program. And they are working very hard to make sure that we get the word out to the community. But like I said, we would really appreciate any help that you can offer, anybody on this call can offer, in making sure that we're getting this message out to everyone. And these are some of the educational materials that are included in the COVID boxes. So this program will be running at least until March 31st. There's a possibility that we may be able to run it 2 or 3 weeks beyond that. Anything that you all can do to, like I said, get the word out, or if you have any questions about this, please don't hesitate to let us know.
Dr. Cox, thank you so much for that great information. A couple of questions. The first one's coming from Sarah, and Sarah is asking, are you finding that those who are economically challenged, have they found PPE like masks that are difficult to get?
We were very fortunate at the beginning of this crisis, beginning of this pandemic, to get thousands of masks from cloth masks from people, quilting clubs and what have you in the community who donated masks to us. We have also been very fortunate in that we have a really good partner in Hilton Head Hospital who has helped us not only get our staff and volunteers vaccinated, but that then puts us in the position of being able to, as soon as we get our allocation of vaccine, to immediately address the needs of our patient population. So these boxes that we put together do contain PPE. They gloves, masks, Clorox, other thermometer, other items that folks need in order to stay safe.
All right, another question coming from Martin. And Martin is asking, is there a website people can access for more information on Isolate Safe?
Yes, it is. You can go to our website at www.vimclinic.org. And there's a button on that website that explains Project Isolate Safe and how to communicate with us.
Dr. Cox, thank you so much for being with us. It's a great program, and I can assure you that the chamber stands side by side with you in helping to get the word out.
Thank you very much, Bill. Appreciate it.
All right, ladies and gentlemen, that was Dr. Raymond Cox with Volunteers in Medicine. And it's great to hear about the wonderful program that they've implemented. As we get ready to wrap up, I want to remind everyone that Chamber Restaurant Week is scheduled for February 20th through the 27th. You can check out the growing list of the restaurants on chamberrestaurantweek.com. And then also check out our Taste of the Low Country silent auction of great dining experiences there as well. Thank you all for joining us today. And please remember to be kind, stay safe, and to wear your mask. We'll talk to you soon. Take care. Have a great day.